Because the typical thing we would give someone would be an antihistamine. And yet antihistamines can cause all kinds of problems, can they not? If you've ever taken one, you know what I mean. As I said, they dry you out, they make you sleepy. Some of them have been implicated in heart problems, so they're not entirely safe drugs. As an alternative, I prefer to use a chemical called quercetin. Quercetin is a pigment. It is what makes apples red. It is what makes onions that are either red or yellow. It is what gives them that color. So, onion soup is a really good source of quercetin. It's also found in berries. It's also found in tomatoes. It's also found in green tea. And it is a very potent anti-inflammatory agent. How does it work? It works by binding to the membrane of the mast cell and preventing it from exploding and releasing all of that histamine. So it's not a drug. It's a natural compound. It's very safe. I've given it to young children for 35 years. I've never seen a side effect from it. So it is an excellent example of how you can use natural medicine or a natural plant-based compound to work with the inflammatory response so it doesn't get out of control. Another example of a natural compound that you can work with to use the body's own inflammatory response in a beneficial way without turning it off are omega-3 fatty acids that Dr. Hanaway talked about. And we made this discovery years ago by looking at the diet of the Inuit from Greenland. These people eat a lot of fat in their diet. They eat whale blubber, they eat seals. They eat a diet that at the time was thought to be very unhealthy. And yet, they rarely have heart attacks. Their blood seems to be naturally thin. They don't have the tendency to clot. So what was it about the diet? It turned out it was all the salmon and similar deep-sea fish that they were eating that was rich in omega-3 fatty acids. And I'll talk a little bit more about what I mean by omega-3 fatty acids. Basically, omega-3 fatty acids are long-chain polyunsaturated fats that are stored in the body and then used as signaling molecules called eicosanoids. So I mentioned autocoids. Autocoids, again, are signaling substances. They act like hormones, or they act like local flags that tell other immune cells what to do. And eicosanoids are one of the primary families of these chemicals. They're 20 carbon lengths. They have a chain of 20 carbon molecules in them. They're very short-lived. So the body makes eicosanoids on demand. It makes it when it needs it. If there's a cut, the eicosanoids are made immediately in response to the cut. They only last for a few minutes, and then they're broken down very quickly. And where do they come from? They're stored in every cell in our body, but especially in immune cells. And they're used as needed. The question is, are there good fats and bad fats? Well, we can talk about saturated fats, and it does appear that some saturated fats that have no double bonds in them, some of them are healthy and some are unhealthy. Similarly, when you talk about polyunsaturated fats, the location of the double bond seems to determine whether the fat is going to be healthy or not. The omega-3 fats have a double bond that's located 3 carbons from the end of the chain. Whereas an omega-6 has a double bond that's 6 carbons from the end of the chain. The omega-3 fats are best represented by EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, EPA and DHA. And these are found in cold water fish. Where did the fish get them? The fish get them from eating algae, from eating plankton. And the future for using these oils is probably going to be algae, because the fish that we can eat, like wild salmon, is headed towards extinction. It's not going to be there much longer. Maybe in the next generation, we're going to see a big drop in the availability of these fish. So the source of these beneficial oils is probably going to be algae. Arachidonic acid, in contrast, is found in meat, is found in other animals besides fish. And arachidonic acid, with the abbreviation AA, appears to be highly inflammatory. Why? Because when arachidonic acid is released from cell membranes in response to an injury, it's converted into eicosanoids that are highly inflammatory, that work in a similar way to histamine to dilate blood vessels, to cause leaking of those blood vessels, to cause pain. All of that comes from arachidonic acid. So these inflammatory eicosanoids are responsible for redness, swelling, heat, and pain, in a similar way to histamine. These eicosanoids are involved in muscle spasm and muscle cramping. In fact, the original research that discovered prostaglandins was related to women who are having menstrual cramping. That's where they were originally discovered. There and in the prostate gland was another source of these chemicals in the early research. And some of the earliest uses of drugs to block production of inflammatory prostaglandins was using drugs for menstrual cramps. That has since grown to using those drugs for all kinds of pain syndromes. Eicosanoids are also involved in the clotting cycle. As I said, the vascular rheology, the tendency for blood to get thicker and to clot more. Lowering of triglycerides. There is an approved drug in the United States right now which is simply fish oil. It's called Lovaza. It's a fish oil that is used for people with persistent elevations in triglycerides. And it appears to be working by downregulating some of these inflammatory eicosanoids that were responsible for metabolic syndrome that produced the high triglycerides in the first place. Eicosanoids are also involved in nerve transmission and in mood. So this is yet another way that inflammation appears to affect mood. Finally, eicosanoids can affect hormone secretion, especially estrogens, female hormones. The two major families of eicosanoids are prostanoids, and prostanoids are generated by an enzyme called cyclooxygenase. Now, we've all come to know about these chemicals because the drug companies have given us a whole class of drugs that block COX. So that has led to the education of physicians to the chemistry of COX inhibitors. And what do COX inhibitors block? Prostaglandins, prostacyclins, and thromboxanes. There is another group of eicosanoids called leukotrienes, and leukotrienes are involved in allergic reactions, in swelling, but especially in nasal allergies and lung allergies. What determines the kind of chemical that's going to be made in a cell? Well, each cell has slightly different enzymes. In a platelet, the primary enzyme is the COX-1 enzyme. So the primary substance that platelets make is a kind of prostanoid called thromboxane. When we give low-dose aspirin to prevent heart attacks, the reason that appears to be effective is because the aspirin is blocking the cyclooxygenase enzyme in the platelets. And it keeps the platelets from being sticky. So if the platelets don't stick together, then they can't form a clot. And that helps prevent heart attacks. Although it does appear that aspirin can do much, much more than that. In the endothelial cells, the primary enzyme is called prostacyclin synthase. And that allows the vessels, the cells lining the vessel walls, to make prostacyclin, which actually dilates blood vessels and helps prevent heart attacks in that direction. Cyclooxygenase 1 is considered to be mostly beneficial. We have this enzyme in our endothelium, we have it in our platelets, we have it in our kidneys, we have it in the intestinal mucosa, and it's making a small amount of prostaglandin all the time. You see, we need these chemicals. They're not all bad. Just because they're involved in inflammation doesn't mean they're harmful. We need small amounts of them all the time. It's only when they get very activated and start overproducing the inflammatory eicosanoids that you run into trouble. In contrast to cyclooxygenase 1, there is the cyclooxygenase 2 enzyme. Normally, this enzyme is only operating at a very low level. However, when the inflammatory response is activated, then the DNA of the immune cells starts to get activated to make more of the COX-2 enzyme, and you produce more inflammatory eicosanoids. What turns on the DNA to make more COX-2? Free radicals. Remember I mentioned when the barbarians are at the gates and the soldiers are releasing the bleach and pouring hot oil on them, it's those free radicals are like the hot oil or the bleach that's being released. And those free radicals then turn on the inflammatory response, so it activates more and more and more. The other thing that can drive this is glucose. So simply eating a substance that raises blood sugar, eating a donut or a large glass of fruit juice or a soda will raise blood glucose levels, and the blood glucose levels then will activate the COX-2 enzyme to make inflammatory prostaglandins. So this is one way that certain foods can drive the inflammatory process. Where we've made a mistake is thinking that these enzymes were all bad, and what we want to do is try to block them with drugs and turn them off. As I mentioned, some of them are good. Here's the COX-1 enzyme on the left, and it's important for allowing platelets to stick. We need our platelets to be a little bit sticky. Otherwise, if you brush your teeth and your platelets don't stick, you could bleed heavily from your gums. This is what we see in people that have leukemia, for example, where their platelet count is very low, they don't have enough platelets, and so they're at high risk of bleeding. So we need our platelets to be sticky, and what makes the platelet sticky is thromboxane A2, and thromboxane A2 is made from the arachidonic acid in our diet. So it's not all bad. We need some of it. The problem is here on the right, is when there's a lot of inflammatory stimulus going on from bacterial infection, from trauma, or certain kinds of foods, will activate the COX-2 enzyme, and that produces inflammation. Inside of the cell, what is going on is the arachidonic acid is actually, it's hanging in the cell membrane. It's a long fat, and it's hanging up in what's called the phospholipid of the cell membrane. When an inflammatory trigger comes along, like a bacteria, it activates an enzyme called phospholipase A2. Phospholipase A2 is like a huge set of scissors. The scissors will snip off the arachidonic acid, and now it's floating inside of the cell. And that long-chain polyunsaturated fat will fall into either COX or the LOX enzyme, depending on the cell. And what the enzyme does, the COX enzyme, is it takes that long-chain fat and it bends it. It bends it into a U shape, and that U shape is the prostaglandin that does the damage of the inflammation. In this case, what we're showing is that the arachidonic acid gets converted into a leukotriene, and the leukotriene now binds to a receptor on the surface of an eosinophil. And when that eosinophil binds to the leukotriene, now it releases the inflammatory cytokines that I've talked about. A very useful test that you can perform on your patients is a ratio of arachidonic acid, the animal-based fat that I mentioned, that is converted in the body into inflammatory prostaglandins, and EPA, which is the omega-3 fat that's found in fish oil. The simple ratio of arachidonic acid to EPA, measured either in whole blood or in plasma, is a very good indicator of how prone the person is to an inflammatory response, to overreacting to an infection or overreacting to a cut. The ideal ratio is less than 3. So there should be 3 times more EPA in the bloodstream than there is arachidonic acid. If the person has more than 5 times the amount of arachidonic acid than omega-3 fat, or EPA, in their bloodstream, that's moderate inflammation. If they have 10 times that amount, that person is highly prone to an inflammatory response. And this is really the basis for what we would consider an anti-inflammatory diet. Eating a lot of fish, eating a lot of algae that's high in DHA can produce the same thing. So this is a very useful test that I think you can use in your clinical practice, that you can order on patients, and it will give you a lot of information about their diet. There are a lot of conditions that are amenable to treatment with fish oil. And I do mean treatment. If a person has sprained an ankle, got a headache, has acute pain, then they may respond better initially to a non-steroidal anti-inflammatory drug like aspirin or ibuprofen. But if the condition is chronic, like rheumatoid arthritis, like lupus, like hypertension, or high triglycerides, with a chronic condition, you don't want to be giving people ibuprofen for years. It's not good for you. It can cause bleeding. It can cause kidney damage. But we don't see that kind of problem by giving a person fish oil. The important thing to realize is that it takes a long time for fish oil to work. It takes months and sometimes years. So it takes quite a bit of patience to work with people. And sometimes you want to have the acute things that you use, the medication to help people with pain in the beginning, but then for the long term, you would use the omega-3 fats. Other scenarios that are helpful: chronic kidney disease, Alzheimer's disease. Now, this is not a person who has severe Alzheimer's, who doesn't know who they are, who's in the hospital. This is for preventing Alzheimer's. This is in the early stages. What about mood disorders? Quite a bit of research showing that we can help children with attention deficit disorder simply by giving them high doses of fish oil. Menstrual cramping, as I mentioned, with dysmenorrhea or menstrual cramping, the COX enzyme inhibitors, ibuprofen, can certainly give immediate pain relief. But if you're having to do that month after month after month, year after year, it would certainly make more sense, wouldn't it, to take fish oil to prevent this from happening in the first place. And all that fish oil is going to do is it's going to displace the arachidonic acid that's in the cell membranes that's contributing to the production of inflammatory prostaglandins. Let's spend a few minutes talking about cytokines. I've already mentioned interferons, interleukins, tissue necrosis factor alpha. These are simply small protein messengers that cells use to talk to each other. Don't know if you can see this very well in the center screen, but if you look on the side, look to the left, and what you'll see is an acute inflammatory response. So this is the response to bacteria or to a cut or person that has an autoimmune disease, that has a flare of that inflammatory response in one of their joints. What you'll see in the center here is that acute inflammatory response activates white blood cells. The white blood cells then release these cytokines, interleukin-1, TNF-alpha, interleukin-6, which then go to the liver and tell the liver to make a number of proteins, including C-reactive protein, fibrinogen, and amyloid. How might this be relevant in clinical practice? I have a patient with ulcerative colitis that I follow on a regular basis, and he has a tendency to get flares in his ulcerative colitis every couple of months. I want to know when he's going to get a flare so I can prevent it. So I measure his C-reactive protein every few weeks. And what I'll see is the C-reactive protein starts to go up before he has any symptoms. So that makes it very helpful, because then I know that I need to change his treatment program. C-reactive protein is really just a marker for interleukin-6, the cytokine. So when C-reactive protein goes up, it's because interleukin-6 is being made by white blood cells in the body. And interleukin-6 is, you may say, an up-and-coming laboratory test that I think is going to become readily available and will be very useful to indicate that a person is prone to getting an inflammatory response. The other thing that happens with my patient with ulcerative colitis is that when he has a flare, his leukocyte count, his white blood cell count, goes up. Why does it go up? Because the cytokines are going down to the bone marrow, and in the bone marrow they're activating the cells to make more white blood cells. So that's another reliable marker for the inflammation that's going on. The other thing that happens is he starts to feel badly. He may even be a little bit feverish, as if he had an infection. That's because these cytokines are going to his brain and turning on the temperature center in the brain to raising temperature. Now, these steps that I'm talking about that occur in my patient with ulcerative colitis are very similar to what might happen with the tooth infection. The same kind of chemicals will be released. It's the same process. The body is using these same steps over and over again in many different ways. And what is it that turns the cell on to make these cytokines? Well, the process is called signal transduction. Signal transduction is when you take one kind of information and turn it into another kind of information. You take information about a structure, such as the structure of a bacteria, and you turn that into the energy inside of the cell that turns on the DNA and makes those white blood cells go from being asleep to waking up, to being stimulated and activated. And this is what it looks like in a diagram. This is a cell, and let's just say it's a typical white blood cell. And on the surface of that white blood cell are a number of receptors. And those receptors can respond to a cytokine. They can respond to what's called an advanced glycosylation end product, which is a very large molecule made from degeneration of glucose, when glucose sticks to proteins. It can come from a pathogen-associated molecular pattern, or a PAMP, and I'll talk about that in a minute, or a damage-associated molecular pattern. All of these things are nothing more than a mechanical structure, a certain shape. When the receptor on the cell sees that shape, it gets activated and it turns on an enzyme inside of the cell called a kinase. There's lots of kinases inside of our cells. When you turn on kinases, they turn on more kinases, and they turn on more kinases. And eventually, one kinase activates a protein that's asleep in the back of the cell called nuclear factor kappa B, NFKB. NFKB is the final common pathway for the inflammatory response. No matter what turns on inflammation, whether it's a bacteria or it's damaged tissue, you end up turning on NF-kappa B, NFKB. NFKB then goes into the nucleus of the cell, binds to DNA, and tells the DNA to make cytokines. TNF-alpha, interleukin-1, interleukin-6. It tells it to make adhesion molecules, ICAM, VCAM, things that make the white blood cells stick to the blood vessel walls. This all comes about by turning on NF-kappa B. Now, pharmaceutical companies are very interested in this because they would like to have a drug that turns off NF-kappa B. But this is not a good idea, because we need this. This is very important. We need the inflammatory response to help us defend and repair our body. So NF-kappa B binds to DNA and activates it to make inflammatory mediators, autocoids. It's activated by infection, by tissue damage, by free radicals, by trans fats, as you might get with hydrogenated fats, by heavy metals, which I'll talk about in some detail 2 days from now. Synthetic toxins can activate NF-kappa B, and so can meat that is cooked at high temperature. For example, meat that's cooked in a microwave oven has been shown to get converted into what's called AGEs. And AGEs then can activate NF-kappa B and turn on inflammation. Where do you see chronic activation of NF-kappa B? Any chronic inflammatory disease. Rheumatoid arthritis, lupus, heart disease, diabetes, abdominal obesity, visceral fat, cigarette smoking. All of these things turn on NF-kappa B. Chronic infection of any type, cancer, autoimmune disease, depression, mood disorders, aging. As we get older, inflammation increases in our body. So obviously we want to be able to keep NF-kappa B from overreacting. We want just enough that we can defend and repair the body, but not so much that it causes cancer or that it damages joints or damages tissue. There are drugs that turn off NF-kappa B. The best known drugs are glucocorticoids, steroids, This is part of how corticosteroids work in inflammatory disease. If a person is having a severe allergic reaction and they get treated with prednisone, it can turn off the allergic reaction.